Bree McLaurin. I'm the Executive Director of Healthy Mothers, Healthy Babies, the Montana Coalition. So we remain independent of the national movement that kind of folded a few years back. And so I'm a public health nurse by training and a PMAD survivor and advocate for this work in our state.
Great. Bree, who do you think should go next?
How about you? You got the mic.
Okay, great. This is Joy Burkhardt. I'm the Executive Director of 2020 Mom, and you'll see we've got a great team here to share a little bit about what's happening around certified peer specialists, hopefully in the US very soon, and a relatively new project based off of some pilot work and a study that we'll go into details on here in just a moment. But it's a pleasure to be here, and Bree, thanks for thinking about bringing us together in this way. There'll also be a few of the policy fellows that are going through 2020 Moms Policy Fellow work along with Bree, who are on from other states. And Allison, we're so glad you're with us from Alaska too. So with that, I'll turn it over to Sam on the 2020 Mom team.
Hi, I'm Sam. I work for 2020 Mom, as well as been an advocate for moms for about 4 years, and I'm in Washington State, I should say that. I'm in Bellingham, and I've also run a support group for 3 years with the GPS model, as well as I'm a board certified patient advocate.
Great. Hey, Megan Peters, would you like to introduce yourself?
Yes, hi everybody. My name is Megan Peters. I'm an AmeriCorps Vista serving with the Early Childhood Coalition here in Helena this year. And one of my projects that I get to work on this year is bringing peer support to Helena. So it's fun to be a part of this group, and nice to meet you all.
Sarah Beth.
Hi, everyone. I'm the Perinatal Behavioral Health Initiative Program Officer in Montana DPHHS, which is housed in our Medicaid office. And that's my dog barking. But I oversee the psychiatric teleconsultation line.
Thank you. Erin.
Sorry, I muted myself because my phones were going off. I had to remind myself to turn them off. So my name is Aaron Foster. I go by Arrow. That's what most people know me as. I am the Director of Consulting and Education for RI International, and we have been working with Joy and several other people in this movement to really bring the peer support and the maternal mental health piece together. Really looking forward to working with Tanya on really merging those two programs and offering them in such a way that it can meet diverse needs of the students that we have. So that's going to be exciting. I just want to say this is the second Montana meeting I've had, because Montana actually contacted us and asked us to be a trainer in the state of Montana. So we'll be submitting in January and hopefully approved in February to actually be a certifying agency in the state of Montana. And I think it's interesting that Alaska is here because we're doing the same thing. We have a footprint. We're finalizing a contract in Alaska also. So this is really, I mean, this has become universal. And it's personal for me because of what my son's mother went through after his birth and then after his death. And so I'm really excited to be part of this. So thank you.
It is very nice to meet you, Erin. I hope we can learn more about your work in Montana on another call. Jenna.
Hi, everyone. My name is Jenna Cohn, and I am an undergraduate student who is taking some time off due to COVID-19, its effect on learning, and I have the good fortune to be interning with 2020 Mom this year.
Great, Jenna.
Wonderful. Allison.
Hi, thank you. I'm so glad to be here. I'm excuse me, I'm the co-chair and chapter liaison of Postpartum Support International, the Alaska chapter, and one of our goals for the next year is to address the peer support option up here in Alaska. And so I'm super excited to hear about this coalition of all these different organizations. And Arrow, I'm I might shoot you a message and see if I can get your email so we can talk more about what's going on in Alaska. I'd love to hear more. So thank you.
Wonderful. Thank you. Stephanie.
Good morning, everybody. My name is Stephanie Morton. I'm the program manager at Healthy Mothers, Healthy Babies, and get to work with a few people on this call in different avenues. So it's cool to be here and putting our brains together to mold something awesome in this moment where it seems like so many people are interested in peer supports.
Thank you. Tanya.
Good morning, everyone. I'm Tanya Fullwider, and I'm the Associate Director at Mental Health America in Ohio. So it's 10:30 here, or 10:40 now, practically midday comparatively. At any rate, so I serve as the Associate Director at MHA in Ohio, and have been running a program called POEM, Perinatal Outreach and Encouragement for Moms, for about 20 years, which is a peer-based care navigation program that includes, so it's staffed fully by peers who are all maternal mental health complication survivors and have been certified through the current certification process, and got into this project because recognizing that the peer certification process now really doesn't adequately prepare peers in the maternal mental health space. Yeah, that's we serve about 2,000 moms a year in that peer program here in Ohio, and so I'm excited to be on this project as well.
Very neat. I've seen your program, so it's great to meet you. Kelsey, if now's good, if you want to say skip. Oh, there you are.
Good morning.
Good.
Now is good. Yeah, so good morning. My name is Kelsey Kyle. I am a nurse care manager at St. Peter's Health. I have a PMHC certification and a PMAD survivor, and then also leading our team with a brand new parental mental health program, which is super exciting and just going to make an amazing difference in our community.
Indeed. Mia.
Morning, everyone. My name is Mia Edidin. I am the clinical director at Perinatal Support Washington. We're a statewide perinatal mental health org in Washington State. We're also provide, most of our services are peer-based, and I'm joining the call to listen and see what you all are doing. In Washington State, we do have certified peers, but only behavioral health orgs, not just organizations that provide behavioral health, but it's a certain designation, can bill for peers. And so even if you have a Medicaid contract in Washington State, you cannot bill for peer services. So that's what I'm here to learn more about.
Thank you, Mia. Stephanie Fitch.
Hi, everyone. I'm Stephanie Fitch. I'm with Billings Clinic in Billings, Montana. Sorry, I don't have my camera on. I'm home with COVID and just look like a wreck. But I run the Moms Grant here in Montana, and it's a maternal health innovations program. And so I'm tasked with heading up the demonstration project, and we do training, education, building new programs that address both medical and behavioral health challenges for pregnant and postpartum women and the providers that are taking care of them.
Sorry to hear you have COVID, Stephanie. Sending well wishes. I'm glad you could make it today. Carrie Colehouse.
Hi. I'm Carrie Colehouse. I am Executive Director for Moms Bloom, which is a nonprofit here in Grand Rapids, Michigan that provides support to postpartum moms through matching them with volunteers from the community. And we are currently, we've been pivoting back and forth from virtual services because of the COVID-19 crisis. So we're currently switched back to virtual for a while, but we're hoping to switch back to in-person services on January 4th.
Great to meet you, Carrie. Pam Konich.
Here I am. Hi, everybody. I'm Pam Ponich, and what am I? I'm a therapist in private practice, and I do some consulting work. Formerly was with the state of Montana till just this week. Now I'm out on my own, but I will absolutely continue with this work because I love it and I love all these people, and I'm really excited to have the rest of you here today. So thanks.
I wasn't sure if you'd make it, so glad you're here, Pam.
Had a little computer issues, but I finally figured it out.
I'm glad. Good. Okay, well, I think we made our way through introductions, so I'll hand it over to Joy.
Great. And I think we'll have Megan, the PowerPoint pop up here.
Okay, is that showing up all right?
It sure is. Thanks, Megan. It's a pleasure to be presenting to you a little bit about the work that you've learned about in our introductions to merge the world of the existing certified peer specialist training and maternal mental health, and what does that look like, and why certified peer specialist. So that's what we're going to cover today, and really looking forward to just having a casual chat after presentation of some of the data from a study that we ran on how meaningful it would be to merge these programs. So we can move on to the next slide. Just a quick overview about 2020 Mom and who we are and why this work interests us. We're focused on closing gaps in maternal mental health care, and our vision is specifically about detecting and treating maternal mental health disorders in the health delivery system, and peer support for various reasons is something we really think should be integrated into the health delivery system, which is why we're very much focused on the certified peer specialist delivery model and how it can support not just community-based organizations, but also in the health delivery system, close gaps there. We can move on to the next slide. I did actually, let me point out that there's a logo on that last slide that just acknowledges we have been working with leaders like Bree and others through, really last year it was an informal fellows program, a policy fellows program. Mia and others on the line this morning are in that program. And we're really excited about being able to support others and learn from others ourselves through our state policy fellows program, and it's why we're here with you today. So thank you, Bree, for bringing us together. So now we can go back or forward to the next slide. Thank you. This is just a little quote about us that I love because it's what we're focused on doing, is looking at opportunities and solutions and tackling them one by one. And this certified peer specialist model is a great example of our work. Next slide. I always like to start with this, and I know that you all know these facts, but if you don't mind, I'm going to go ahead and read them again, and it's why we all are here. So did you know that women in their childbearing years account for the largest group of Americans with depression? Did you know that the American Academy of Pediatrics has noted the prevalence of depression and anxiety in teen girls is skyrocketing? Did you know that maternal depression is the most common complication of childbirth? Did you know that there are more new cases of mothers suffering from maternal depression each year than those diagnosed with new cases of breast cancer? And did you know that studies are illustrating COVID is causing significant elevated anxiety and depression in all Americans, or the full American population, and of course the perinatal population is no exception. A recent study illustrates that prior to the COVID crisis, 15%, and we see a range between 10 to 20% of women will suffer from maternal depression and or anxiety. And post-COVID, kind of in the thick of things in June, that number was at 47.7% clinical level depression anxiety. And despite all these things, despite the prevalence, maternal mental health disorders still go largely undiagnosed and untreated in America. We can move on to the next slide. So this really shouldn't say fireside chat yet. That was my mistake for forgetting to take that off. You already met the team who will be talking about the study and the cohort training for mothers that we're looking to launch this year in 2021, next year in 2021. There we are again. We can move on to the next slide. We don't need to go into this, but just a reminder, there's a range of disorders, and we actually know that peer support can help prevent or mitigate risk for these disorders as well. So think about peer support supporting all of these bubbles on the slide. All right, we can move on to the next slide. So what is peer support? I think you all have a baseline understanding of peers, moms helping moms, basically, or those with lived experience helping others with lived experience. We wanted to start with the definition from the Centers for Medicaid and Medicare Services, CMS, and we'll start with the middle box. They define peer support services as evidence-based mental health model of care, which consists of a qualified peer support provider assisting individuals with their recovery from mental illness. Recovery is an interesting word that we're starting to hear more even in the mental health space, and it has its roots in substance use space, which peer support has roots in as well. At the top box, we acknowledge that there's recognized efficacy of using certified peer specialists, of course, by CMS and SAMHSA. And CMS first issued a paper to state Medicaid agencies in 2007 about the importance and efficacy of peer support and reimbursement being permitted for peer support. The yellow box says that these agencies also recognize the importance of those with lived experience in providing peer support as consumers of mental health services, and that they can be an important component of a state's delivery of effective treatment. Next slide. So what can and do peers do? So you'll see a range of services that are provided by peers. Some of these we don't often think about in the maternal mental health space. Emotional support, that's what we mostly think about, and it's so incredibly helpful, we know, for mothers. But also informational, so connecting mothers and those with lived experience to community-based resources and guiding them through things like insurance, even like what connections and what resources should I be thinking about. Instrumental, so providing concrete support, similar to informational, but really getting them connected with concrete support like housing, employment opportunities. That can be a function of peer support as well. Affiliation support, so where else can I get connected with other mothers or others with similar lived experience outside of just getting support from a peer. Next slide. So what do we mean by certified, and why does that matter? So you can see again from CMS, peer support providers, when we talk about certification, must complete training and certification as defined by the state. And CMS is really, I think all have background in, talks about this in relation to payment of services. So for CMS to endorse payment of services through the medical model, this is what they're looking for. So complete a training and get certified by the state. And we're so glad that Montana and Alaska and others, Ohio, are starting to look to RI, who's a real leader in this space. Training must provide peer support providers with a basic set of competencies and certification tests for those competencies. The next section of this slide talks about sitting for that test through an agency identified by the state, so such as Recovery or RI International. And the testing process we think is really important because it, again, tests for proficiency. So have I learned and retained information that's necessary to provide these key services to peers and patients, and also allows the peers to be issued a professional credential. letters after their name. And we think this is really helpful to provide, Tanya, you say it best, so I'm going to let you actually say it, but provide stable and potential long-term employment opportunities for peers who in our space have mostly been volunteers. And mothers are really looking to be able to provide this as a professional service as well. And then we acknowledge that nearly every state has commissioned peer support certification, a state commissioned peer support certification process, but these processes look different. As we heard from Mia in Washington, even if you're already billing Medicaid, you may not be able to employ and get reimbursement for services that you provide. 2020 Moms actually looking, Ohio has a similar constraint or a different constraint, but something that's also a barrier. 2020 Moms looking to look at policy solutions at a state level to help close some of those gaps, along with other national players like Mental Health America and the Depression and Bipolar, I always forget, Services Alliance, DBSA, is also very big on peer support at a national level and closing gaps at a state level as well. Next slide. So we alluded to this. One of the other incredible things, besides testing for proficiency, issuing a credential, is that reimbursement is possible through Medicaid, as we've heard. And most states already do reimburse for certified peer specialists time that's billed through Medicaid programs. At least 36 states do so now. And you can see a little bit more about Medicaid waivers, et cetera. Few states also fund grant programs to finance peer support specialists. So important to think about that potentially as well as a first step, or even a long-term solution if you've got the oomph to keep on piecing together grant opportunities. Next slide. We'll go into a little bit about why we believed and what the study found that it was this maternal mental health population is right for looking at certified peers. And you can see all of these bullet points here. One thing that I do want to point out, we know that peers can meet mothers where they are, in particular low-income mothers who also have fear of the health delivery system and fear of acknowledging that they may be suffering from the depression or anxiety, and all that comes with those disorders, like rage sometimes can be a problem. Also intrusive thoughts and OCD. There's a lot of things that women are afraid to share with their healthcare providers for fear of having babies taken away from them, and in particular, the Medicaid population. So that should really be emphasized here, and I'm realizing it's not, and I wanted to point that out. And of course, in addition to all these really important bullet points on the screen. So let's move into the study, and the next slide will take us there. So as you can imagine, we just had this hypothesis in our head that this existing framework for training peers and offering certification really had meaning in our space. We applied for a grant to study this and see what modifications to those training programs might be needed. If in fact there was the study found that this was a helpful model for maternal mental health. The grant came from the Hope and Grace initiative, from the Skincare Line philosophy, which some of you may remember from the old days when we got to shop at Macy's and other department stores. So we are grateful for that initial funding to do the study. It feels like it just ran, but it ran in 2017, 2018. And we looked at the two markets in the US that have the highest rates, we believe have the highest rates of postpartum depression using census data to predict risk. So things like low socioeconomic status, young age of mothers, single mothers, etc. And looked at studying in the Phoenix metropolitan area in Arizona and the Houston, Texas metropolitan area, although we ended up having to pull in peers from Austin because of the hurricane that hit in Houston at the time. The report was just published this The report, that should actually say 2020. The report was published in January 2020. So Sam, let's make a note to update that. It took us a while to do all of the evaluation after the pilot and the training was actually conducted. So next slide. So what was the training? What did it look like? And Erin will have a chance to go into detail with you about this if you have more questions. But the baseline peer support specialist training was a training that was offered for 2 weeks. It started out in person and moved to virtual, and not because of COVID. This, of course, was a while ago, but we found that that was important for a couple of reasons. We'll get into some of that in the Q&A fireside chat. And then a maternal mental health component was added on at the end of the training. Some of the takeaways were that we should weave it in instead of adding it on. That was feedback. So next, we can move on to the next slide. So the study design, I'm actually not going to go into the detail of this, but you can see some of the questions we asked, how many people actually went through the training. So, you know, relatively small sample, but nonetheless important findings. We can go on to the next slide. So the results of the training confirmed what we thought would be helpful, is that the course was helpful, including for peers that had already been providing peer support services to mothers in the past, that the facilitation of the course made it very clear to gain additional understanding. The tools, etc., were helpful in providing services. So you can see overall majority support, endorsed the helpfulness of the training and increased their confidence. We can go on to the next slide. So some of the challenges, what next? Okay, so I just went through this training. I may be on my way of becoming certified and taking the test, but then what? Like, how do I find employment? Where do I use my skills? Challenges. So we started the training, and Erin can talk a little bit about this, and by weaving mothers into an existing peer support training that included other peers, including those with substance use disorder, lived experience. I believe, Erin, you can talk about this. It's kind of fun to unpack it it's interesting to unpack it during the fireside chat, but general population, and that was deemed to be a challenge, that it was helpful to, you'll see on the recommendation side, have a mom-specific or maternal mental health specific course. The environment needs to be sensitive to new moms. That you can imagine includes lots of different things, including having young children or baby to care for, and what are the hours that are offered, virtual versus in person, all of those things. So recommendations, we already hinted at some of this, so I'm not going to go into this in detail, but the last two bullets we didn't really talk about, but are some recommendations that we're considering, is how do we provide peer support or support to those who've been trained and certified post-training on an ongoing basis. So once they are placed, what does that look like? What does that support look like? And then how do we find jobs? And should we think about job boards for peers once they become certified? Next slide. So just another slide on how we might use maternal mental health peers in our work. So, you know, you heard from me that we really believe that the health delivery system should be thinking about utilization of peers. You can see the opportunities to do so here. We were just on a call with the American College of Obstetrics and Gynecology yesterday, and they're really interested in this work because they think obstetricians, especially if there's more than one in a practice, would be very interested in having peers support their screening and care management protocol development of treatment plans being augmented by peers. What does it look like? How do we find community-based resources? And so that's pretty exciting. So helpline, voice, and text. We really think peers that provide the services should have gone through this kind of baseline training and be certified if they're providing that kind of help. Support group leaders or co-leaders. Oftentimes you all probably know and may be facilitating as RNs
or LCSWs, support groups. We think having a peer co-lead those groups is really impactful. If not fully peer-led, it's helpful to have a peer also on those teams. Navigation. You heard from Sam on our team that she's actually certified as care navigator, so specialized intervention. So if I need treatment and I'm having time getting clinical treatment, this can be an important navigation support for moms who are overwhelmed and families who are overwhelmed and complex, insurance coverage issues. And it's something to look forward to in the future, in particular, is seeing how this can be rolled out and supported in a bigger way as well. And then direct provider referral and ongoing follow-up. So, I think that you were prescribed medication, you told me you were, how you tried it, how's it feeling, and then potentially integrating back to the treating provider, prescriber, for example. So on to the next slide. We are wrapping up here. So where are we now? And we know that you're really probably going to be interested in tangible next steps. RI International, as you've heard, is partnering with POEM. Erin and Tanya are working together to integrate this training for cohorts of mothers across the country. In California, there's a grant to be working with Black mothers. So that will be a priority, but it's all being looked at in tandem. And the goal is to have training launched in 2020. Erin and Tanya, I don't want to put words in your mouth, but would love for you to add additional information. And one final point that should really be its own slide is that we really view this training as baseline fundamental training that all peers should have. And other training programs, like there's a method called the Inspire method out of Houston, for example, that's gaining traction for the BIPOC community. Many of us know the GPS, Group Perinatal Support model out of Massachusetts. That's been a phenomenal model. That's like a method in our perspective, in our minds, that can be added, right, to baseline training for peers. So how does it all fit into what you might already be thinking about? That's how we view it, that this is sort of fundamental baseline training, and then other methods can be added on and taught by certified peers. So with that, you'll see our contact information on the next slide. And then we just want to open it up for conversation about what does Montana think? And of course, others on the line, feel free. Bree, I think that's appropriate. You let me know for all of us just to have a conversation about next steps.
Yeah, I think one little, if I could just ask you to just, so say I'm a mom in Houston and I want to become a peer support specialist, like during 2017. Will you tell us the story of how that mom was connected, trained, and kind of what, like one of those individual experiences that was studied? Could you kind of just share what that looked like, just to make it more concrete on kind of how they were found and where they were working, things like that?
Yeah, and if you don't mind, we'll talk about Phoenix, because Erin actually did the training in Texas. It was another organization that was a training and certifying body via Hope, and RI is actually now doing that work in Texas. But Erin has hands-on experience in Phoenix. I'll start, and then Erin, if you don't mind just jumping in, what we've seen. So it can happen in a couple of different ways. There are mothers or peers that want to go through peer support training without having kind of a home base to provide those services. And we had some of those moms go through either of the cohorts, and that's where the then what comes into play. And the other side of the coin, or the flip side, is when institutions, so clinics, community-based organizations, hospitals. In Arizona, we partnered with a hospital system. One of our core players in the pilot partnered with a hospital system, St. Joe's, who's using peers in the NICU. So you might find that, okay, we are already using peers, or we want to use peers. We're going to employ them, and then we're putting them through the training kind of on our dime. And we're already billing. We're finding in the California work that we're doing, which is centered around doula organizations, that doula organizations like to think about
We're having audio. I don't know if it's just me.
No, Joy, we can't hear you.
Okay, we lost you.
Uh-oh, I'm on my phone
you're
now.
here.
Is this better?
Yeah,
Interesting. Okay.
we heard doula organizations in California and then lost you.
Okay, good. I'm just going to hold this up. So there's, I was saying that there are institutions or clinics or community-based organizations that may already have potential trainees employed, and that's helpful too. The steps after for those organizations that we see is some are not billing Medicaid yet, and they have to learn how to become a billing agency in the state. And then they also have to think about, okay, I've got to put these people through training, so I've added costs because I'm paying their salary, but they're not providing services while they're in 2 weeks of training. So you see them coming through both ends, an organization that wants to train their staff, peers, or doulas, for example, and then you see moms who want to get trained and then figure out how to get plugged in. Erin, let's talk about Arizona training, if you don't mind. We worked with an organization called Women's Health Innovations. They're actually behavioral health community-based organizations. So they're a nonprofit, but they provide clinical behavioral health services. And they were not Medicaid, and they were not billing Medicaid at the time. They specifically became eligible to bill Medicaid so that they could hire the peers that they put through this program. And the peers that they put through the program, that they helped us identify to go through the program, were patients that they had already serviced. So that's how we found those moms. Erin, I think there may have been, and Cindy on our team knows for sure, a couple other mothers that came through and were not ultimately, employed or pulled through from Women's Health Innovations. But Bree, hopefully that helps. Erin, please jump in and add some more detail.
Yeah, I think you've hit every topic. I think there were 5 in the first cohort. It's been so long. It seems like it was yesterday, but it has been a while. But I believe there were 5 in the first cohort that went through, and they did come from varying agencies. I think one of the things that I would add to this is the study for us showed that the world of healthcare has changed. It is no longer individual organizations providing specific services, that the time has come where collaboration is the prime objective now. It's no longer, I'm going to sit here and I'm going to do substance use. I'm going to sit here and I'm going to do forensic work in jails, or I'm going to do this. It's okay, we have a specialty here. Let's collaborate with this agency, and this agency, and bring it all together, which has really opened up in Arizona specifically, and in California now, to some degree, now that SB 803 has gone through, and they are developing their peer certification program, is that the collaboration is the important part now, which is why this is exciting, because there's so many people being brought together to do this. As you know, one agency doing this, especially if you're a nonprofit, would be absolutely overwhelming. The ability to collaborate and bring all of this together really opens up the opportunities in a more timely manner too. So what could take, and kind of compare it to what we just saw with the antivirus. What would have taken normally 3 years in a regular world, they were able to do within 1 year, because there was so much collaboration. There was so many different agencies coming together to make this happen. And that's what we're beginning to see in healthcare in order to make it happen now. So we had the 5 components. We learned a lot, and I'm really looking forward to working with Joy on developing how we had a lot of discussion from what came out in that 2020 report, the January report, but really to move that forward. How do we build it to where mothers can actually take care of what needs to be taken care of, at the same time becoming certified, becoming certified so that they can move forward in their careers also, whatever that is. I know, I can't remember the one in that cohort that has her own business now doing this. I can't think of her name right off, which was fantastic.
The fourth trimester project. Yeah, the fourth trimester project. So
It's
yeah,
amazing.
I know who you're talking about.
Yeah, it's absolutely amazing. So did that answer the question, or did I go off on a tangent there?
I think you answered it, right, Bree? I mean, it's just, there's a lot of moving parts. I was going to say this person that ran her own business, she's doing, we'll pull that, she's a 2020 Mom Ambassador, we'll pull that as a case study of how she went about doing it, but she's working with employers or something too. She's doing some really cool stuff, but as a certified peer and getting paid for it as a certified peer. Yeah, thanks for reminding me, Erin. We'll get that.
Yeah, I was surprised. I turned on the news one morning and it was like, there she was on ABC News, our local news, talking about it, talking about, you know, the peer support and how she does it. It was phenomenal. And that's the type of thing we need to see going forward too, is making sure that we know that stigma around mental health, whether that's maternal mental health, whether that's mental health associated with, I don't know, spinal cord injury, with associated with any type of rehabilitation, that stigma needs to be brought down. And people going through this and then speaking out about it is really powerful, extremely powerful. So, but the study also showed us that we can create these specific trainings. Previous to this, we had peer support coming in, and then if you wanted a specific training, that was attached at the end. I'm really looking forward to building with this team the very first integrated, to where it's specifically maternal mental health, still get the peer certification, but mental health is woven through. And of course, that has a lot of moving parts. How do you get enough people to actually, you know, be fiscally responsible and have enough people go through, though, that can support the program? I think if there's a silver lining in the experience we've had with COVID, and that is we are now able to bring people from multiple states and train them. So we're not just training 6 people over here in this county now. We can have those 6 there in that county, and we can bring in 15 other people from across the country and train them all at once, which has really expanded our ability to increase the workforce in peer support where it wasn't able to be increased before. Due to funding, due to state regulations. We're still tackling North Carolina and Pennsylvania with their refusal to allow online training. North Carolina has given in a bit. Pennsylvania we're still working with. So there are a few states that won't allow online. But what we found was the online training, and thank you, Joy, and your cohort and everybody that worked with us on that, because we were really able to prove to the world that it was just as effective online as it is in person. So
that is really exciting. And yeah, congratulations. And in Montana, I would say that as we're at a local level, we have, you know, in some of the communities talking about implementing peer support. That's our #1 question is there a maternal mental health education component of this training? And, you know, that's not available. So it's really exciting to hear that's coming. For those of us who are working on building a system, like what's the timeline? Like what can we look forward to or access to this?
Is that directed at me or Joy or Tanya?
I know, I'm like, Erin and Tanya, that one's for you. it's like all about resources right now, getting it together.
I would like to say this, that it's the dedication has been phenomenal on the part of this movement. COVID did put a kind of a crimp, and we had to readjust resources, look at how this is going to happen, redo the training to make sure that people were engaged online. But Tanya and I actually just spoke this morning by email about what do we need to do? What's the next step? I can't do this on my own because I'm not the expert in that. But bringing Tanya and her team and all that into it, I'm also going to bring our lead, Terrence Smithers, who's been doing this for 17 years and has written a lot of the curriculum, bring him into, so we can weave that in. The specifics on how to make that work seemed daunting at first, but now that we're in a virtual world, it's a lot easier. For us to be fiscally responsible as a nonprofit agency, I can't send somebody out to Montana to train 3 people. Can't do it. But now that we're virtual, I can bring 3 Montana people into any training that's maternal mental health oriented. And I can bring Alaska in, I can bring Ohio in, I can have people from California, from Texas, anywhere they want to be, and bring them in, which, as we know, that diversity and those experiences, because each region is a little different. Each region not only has its cultural, the cultural aspects of peer support, but it has the cultural aspects of motherhood, of how that's approached. What are the cultural things? I mean, we just did one in Northern Arizona on the Native American, the Navajo Nation. What an amazing experience. I mean, they came and did a native dance and had a huge celebration that was absolutely beautiful. So being able to reach these populations that have not been reached is now possible with this virtual, and I think it's going to make it a lot easier once we roll this out. We've also, one of the other things this did was, and thank you again, Joy, and the cohort, because I had been struggling for many years to get our team, our executive team, to allow us to go online with a school catalog where people could register on their own. We are now partnered with Canvas Catalog. We hope to roll that out February 1st, where people will actually be able to pick what training they want. So if there's a maternal mental health training, we can put it up there. I'd like to talk to Tanya and Joy a little bit more about that, because we'd like to host specialty trainings if you want to on there too, that you guys do, and make it easier for you to allow people to come on. So there's a lot of things that came out of this study. I know there's a lot of statistics that said this, this, and this, but there's a lot of things that came out of this study that really moved the whole movement, not just mental health, but peer support, mental health awareness forward. So this has been exciting.
Beautiful. Okay, well, I kind of hogged the questions. We have some time left still. Who else has questions?
And Bree, I'll just add as Joy, Tanya, jump into you, both of you. Erin, it's always fun to listen to you, and you provide such color, background, and you know, it's a work in progress, right? But I think our aim, my aim, it's not 2020 Mom that will be doing the training, but we know that the field is so ready for this like yesterday. I think our collective aim is to see something like this available. Last year, a few months when we presented, we said, you know, Q1, Q2, right, Erin and Tanya? So, you know, my hope is that we can keep nudging these two to get something out sooner rather than later that can be available, as Erin said, to people in various states. New York, you guys all remember Sonia Murdoch, who's in the Policy Fellows program. Those of you who are in the program, they're really interested in looking at some of this too. And RI is a perfect partner since they're in all of these states. So Tanya, anything you want to add while we're waiting to see if any other questions are coming in?
Not a lot. I mean, I think you covered a lot really well, Joy and Erin. Yeah, I would agree. You know, Q1, Q2 is what we're looking at for. I think we'll probably want to get through the first cohort in the second round project, so that we can see how it goes, make any adjustments, because this is new, you know, to do this. Nobody's ever done it. So we want to really see, you know, do a run, and then see what things we might tweak before we would roll out the training for everyone. So, but, you know, I think that the big piece that is what led us to want to be involved is the peer element, really, in maternal mental health. You know, there aren't any if you want a maternal mental health training, who's going to teach you? A clinician. And there's a difference. There's a huge difference. And peers don't need to know all the same things that a therapist needs to know, but they also need to very much understand maternal mental health and what that looks like and the unique qualities of it. But they need to learn it from a peer who is experienced in the delivery of peer support services. So that's just a really big piece for us in this integration is that, we've been doing this peer work for a really long time. We sit very, very closely within that, like Joy was talking about, in that health delivery system. And so, just kind of pulling those together. We certainly don't need to do RI does the peer training, right? They have perfected that model. So we don't need to, to take over and do that, just to integrate in, this experience of, delivering peer services to the perinatal population.
And I think, Tanya, I really like what you brought out, that, they don't know how, they don't even know how to do clinical work. Because one of the things that we've experienced along the way is people want peer supports to come in and do the peer support work. They want that peer in there, and all of a sudden they want them to be mini clinicians. And it's not that. Their job is to support the individual. Their job is to translate. So I often think of peers, and I'm a peer myself, as a translator. I do need to know the way they talk. I need to know how therapists talk. I need to know how doctors talk. So I can be that conduit between the person receiving the services and vice versa. I'm able to translate what it feels like when someone is feeling this and unable to express it. I can express it because I have experience with that, and I know how to talk to a doctor and express it in a way that a doctor or a therapist would understand it. Critical component, very critical component. Thank you for bringing that forward.
That was a really important piece. I would agree. Other states, other folks in Montana have questions while we have these leading peer specialists from our country on the phone or on the Zoom?
Well, I'm not in Montana, and I don't really have a specific question. I think I'm still trying to imagine how this could play out in Alaska. And Erin, I'm going to email you and just see if you have any insights on so our problem has been kind of where to start and how to start to build that kind of interlocking, connected approach to getting a lot of different agencies involved. And if anyone in Montana has any thoughts on how to best do that in a rural state, please let me know. We're pretty spread out up here. But I did want to say, I really appreciate the framework of employment for moms. I work in maternal mental health as a clinician. I'm a psychotherapist, and I see that a lot. Mom starts to feel better. She's ready to expand a little bit and develop her new identity, and she doesn't really want to go back 100% full time to work. There's a gap in there, but she does want to be earning and contributing to her family. And I see that as a really big maternal, mental health consideration, to feel that value of the actual paycheck of your work is valuable. And so I love all the models that are volunteer based, but what I'm looking to do up here is build something that's more sustainable and meeting some employment needs, as well as support needs, and not asking so much of our moms that are recovered, because it feels a little lopsided. So I just want to say thank you for putting that out there.
I love that, Allison. I want to use this in a video, by the way. That was so beautifully said. You didn't realize it, but I'm like, that was so good. Anyway, very good.
I would want makeup if I knew you were going to do that.
Zoom recording. We want your permission in the Zoom recording. That was so good to talk about why this, one reason why this is needed. That's fantastic.
And the other
Allison,
piece.
Joy,
oh, sorry, Joy. Go. Sorry. Go
I'll
ahead.
just add that we can help Allison on convening multiple stakeholders in your state. It's one of the things that we've done with Utah and Florida in particular, is how to build a multi-agency, multi-player stakeholder task force. And this might be one of the first things on your agenda. So if you want some help on that front, we're here to provide that kind of support as well.
I love that. It feels a little monolithic to be well, I don't know, I'm just going to send an email out into the void, and then you don't have that personal connection, they don't get back to you.
We have like a template email and a formal invitation. We have all these things that Utah and Florida used to form their now coalitions. And one of them became a PSI chapter ultimately. So we're happy to help with that.
Okay,
Beautiful, Allison. Thanks for that question. Anybody else?
I just want to say is for 4 years, I was a full-time volunteer as a mom who went through postpartum depression and anxiety, and how much I appreciate all of this. And now that I am working with 2020 Mom, it's great, but how much I resonate with what Allison says and what Tanya said. And, you know, I'm privileged enough where I don't have to work, but you only can go so far volunteering before you're burnt out. And to know you get paid for your experience and your knowledge is so empowering to a mom, and to feel included again and not to feel just as a mom, which sometimes can feel so, which it's not a small task, but it feels that way when maybe you've worked before. And so I just appreciate all this work and I'm so excited to be a part of it, but all of it resonates as someone who was a full-time volunteer for many, many years. So I just wanted to add that.
Sam, I think that also points to including a much broader population of moms that have something to offer, but need to get paid for their time, that can't not work. So I feel like that's an important piece too.
Exactly.
Goosebumps.
Joy, Stephanie, before she left, sent me a question through the chat box. And then she left and I didn't have time to get it before she left. Would you mind contacting her and see if she's comfortable with emailing me or giving me her contact so I can respond to her question?
Yep, and Bree, I think you might be able to help us on that.
I can help you with that. Yep.
Okay.
I have an email. I have your your email and a draft ready to connect to learn more about what's going on in Montana. So I'll make sure to connect you with Stephanie Fitch too.
All right. Thank you very much.
Yeah.
Great. Well, Bree, I think we're at the top of the hour.
We sure are.
Like, great.
Yeah. Well, I just really appreciate everybody coming together this bright and early sunny morning, at least in my house. And this is really exciting. And I love that we have a group of thought partners with such passion and wide net of experience to draw on. And you're always welcome in the Montana calls if you ever want to pop back in. And let's stay in touch. If you guys make progress, we want to hear about it. And I imagine Joy's our connector in the policy world, but let's stay in touch.